Hello everyone, my name is Megha Prasad and I'm joined by Dr. Dawn Abbott. We're with the Fits on the Go blog. Thank you so much for being here.
Thanks for interviewing me this afternoon. It's been a terrific American Heart Association meeting this year.
I know, hasn't it? What's been some of your favorite science so far?
I really loved all the late-breaking clinical trials. There have been a lot of surprising results with respect to the Euclid trial, looking at the efficacy of ticagrelor versus clopidogrel for prevention of events in patients with peripheral artery disease. I was very surprised that there was absolutely no benefit of one drug versus the other, kind of going against the hypothesis that more potent antiplatelet therapy is beneficial in those patients. I think that raises the whole question of how many events are related to atherothrombotic events versus another mechanism, and whether we need to be looking for a different target to inhibit for those patients, because they still have very high event rates.
Could you tell us a little bit about your own science? You've had some science that has had some press with TCTMD, TAVR readmission rates. Tell us a little bit about that study.
Yes, I'm very excited about that. That was spearheaded by one of our fellows who's a general fellow at Brown in our cardiology program, Dr. Deval Kolti. And he used the recently available readmission database to look at over 12,000 patients that underwent TAVR. And we found that nearly 1 in 5 were readmitted within 30 days. So that's quite high, and it's something we can target to improve outcomes and reduce cost. In particular, we found that patients that had complex, like long hospital stays, those that had acute or chronic kidney disease, as you would expect, those that had transapical versus transfemoral were more likely to be readmitted. And we also found that about 60% of the readmissions were not cardiac, but rather related to things like infection or bleeding or respiratory failure. So I think that gives us a lot to think about, and it's an important work, and we were fortunate to hear that it will be published in Circ Interventions. So, yeah.
Well, we look forward to reading that manuscript coming out soon. Congratulations.
Yeah.
So a little bit shifting gears here, as a female in interventional cardiology, do you have any advice to general fellows that are aspiring or deciding between imaging and interventional cardiology or EP and interventional cardiology, what your experience has been and what the rewards and challenges have been?
Yes, you raise a terrific point. I'm a big advocate of women who want to pursue interventional, and I certainly recommend it. I'm very satisfied with my career, and I've been reaching out not just to general fellows, but actually to medical students, and even as young as undergrads, to try to stimulate some interest in the field, because I think the more diversity we have in the field, the better we're going to take care of our patients, and the more well-rounded our research program will be. And so I would say there's really no limits, and everybody can find their place in interventional for sure. Yeah.
I'm sure you've had a busy meeting, but any favorite places in New Orleans?
I did go and get beignets this morning and the hickory coffee, and that was quite good. I managed to keep the powder off my outfit, so that was great. And I'm looking forward to trying some of the restaurants tonight, so we'll see. It's good food.
Perfect. Well, thank you so much, Dr. Abbott, for joining us today. For more videos like this, please go to www.youtube.com/fitsonthego.